connecting to cloud server. None of what we're going to talk about today is medical advice or instruction. You do need to speak to your own medical team about anything that relates to your health and well-being. Please don't stop any medication or start taking any supplements without consulting with a fertility nutritionist. It's quite important not to take supplements or self-prescribe those, because especially if you're going through IVF or you're on prescription medication, they can interact. So I'm not actually going to cover supplements today, but I will mention some nutrients, which you sort of might think, oh, you know, I might take some of that, but they are powerful things and can you can sort of overdose and cause more trouble if you're taking the wrong things or too much of them. So Abby's already talked about what we're going to talk about today. So I've got quite a lot of slides to cover today. I apologize, they're not pretty. I just sort of put them together really quickly, but I'm going to go through them really quickly. If there's anything that you want to ask, possibly maybe at the end, we can go through them, or if Abby thinks that there's something that's come up that's relevant or not clear, then just interrupt me, Abby, if you can get a word in edgeways. Okay, so let's take a look at male fertility then. So male fertility, you've probably heard, has been declining at staggering rates over the last few years. So since 1973, between 1973 and 2011, sperm counts decreased by 50% in the Western countries. Testing has changed a little bit in that time as well, but there's quite good data on this now. From my point of view, a man's fertility is a marker of overall health. So sperm abnormalities can be the canary in the coal mine, which is sort of telling us that there might be other underlying things going on, which we may need to investigate. And there is some data on kind of male health later on sort of being impaired if they've had a fertility issue diagnosed earlier in life. So it is something that we probably do need to be aware of and sort of look at, I think, as opposed to just some sort of jumping. Sorry, someone say something? No, as opposed to just jumping straight into IVF and sort of thinking, oh, that will solve the problem. Because from my point of view, we're looking at optimal health and wellness and not just kind of getting pregnant and then leaving that sort of everything else to one side. So male infertility contributes to about half of all infertility cases, which is why it's so important to involve the male partner. Very often in my experience, the male partner's not really tested that properly. They might have a semen analysis, and sometimes that's the extent of the testing that they go through, which I don't think is enough, even if it's deemed fine. You know, I think that there are other, well, we can always look a bit deeper as part of a couple's fertility workup. In my opinion, male fertility absolutely can and should be optimized before the couple embark on an IVF cycle. And a lot of the time, I'm finding that women are having treatment on behalf of their partner, which could actually even have been avoidable. And IVF treatment is unpleasant and expensive and taxing on the emotional side and you know, all areas really for both partners. So it really is worth kind of pausing a bit and looking at overall health before that treatment starts. And the main theories about why the male fertility is declining at such fast rates is points to environmental issues, so food and toxins in our environment. So just very briefly, medically, what can go wrong? So a varicocele is sort of like a varicose veins, which can appear in and around testicles and cause the semen to actually, or the area to heat up and thereby cause damage. And you would need to see a urologist to investigate this. Or you can book yourself in for a testicular scan privately. If you are found to have one of these, this can be operated on, and I'm told by fertility specialist urologists that it really does help improve sperm health parameters in the majority of cases. Infections can also be causing trouble in sperm production, and it's so easy to have a semen culture, which is just where they look at what grows in a semen sample, and quite often this can be treated with antibiotics quite simply, and fertility is restored. In my practice, I have seen a lot of the time, if women are having repeated urinary tract infections or infections generally vaginally, I always get the men tested, even if all of their other sperm testing is fine, because I find that often it can be a shared infection. And most of the time, these infections you would have no symptoms at all, and they're not necessarily sexually transmitted. So I think a test is worth having. It's very cheap. What can go wrong in terms of hormones? So testosterone is a key male hormone that's involved in sperm production. And lower testosterone causes changes in sperm production and also lower libido. We don't actually replace testosterone medically, ideally, for fertility. We do other things. And lifestyle is huge in increasing testosterone levels as well, with those are low, unless there's some sort of medical reason for that. Prescription drugs or over-the-counter drugs, is worth being aware that they can interact with fertility. So we know that ibuprofen, for example, which you can buy over the counter, it can affect male fertility if taken in very often. And also certain steroids can affect male fertility. And as I said at the start, please don't stop taking any medication that you have had prescribed, but you may want to talk to your doctor about seeing whether there's an alternative for you. So once we've addressed the things that we've just talked about, we're left looking at lifestyle and dietary strategies. So what are those? So from my point of view, I like to work with a couple for about 3 months, because it takes about 90 days for an egg to mature, ready to be released, and it takes about 100 days to mature a batch of sperm. And we have a huge window of opportunity here where we can really work on affecting the quality. Just check where I am time-wise. Okay. So just super quickly about semen testing, really, the gold standard is 2 tests 7 days apart, which I've never actually seen happen in reality, but that is what you're supposed to have, because we can't really take just one test as kind of the answer, because it's a snapshot in time, really. Just like a bloodshot just tells us what's going on at that moment in time. So a standard semen analysis would look at the number of sperm in the semen. It would look at the movement and whether they're moving properly, and the volume, so how much there is. And if it's very low volume, then we need to be asking the question whether that was actually collected properly, which again often is missed. And we look at the shape, which I think I had a picture here of the shape. So there's lots of different things that can go wrong. They can have several heads, or cut off tails or whatever, but it should look like the one on the very left there. And just so you're aware, or sort of I suppose, of how a semen analysis is looked at nowadays, because semen health is going down, or male fertility is kind of declining, they keep revising the reference limits. So nowadays, if you have, and this is the one I see mostly being problematic, is the morphology. This is the one I work with mostly with when it comes to male fertility. If you have 4% normal forms, which means that 96% of the sperm looks abnormal, you tick the box for being in the normal range, and you're sort of off you go. There's nothing wrong with you. Let's focus on the female. Whereas actually, it used to be considered normal when you have 15% normal forms, and actually, well, 30 and 50 before. I mean, some of this is down to testing, ways that testing has changed, but still, you know, if we're looking at sort of 4, 5, 6% normal forms, that kind of does raise questions. And also it does, you know, for IVF or for ICSI, you know, they can pick out the good looking ones and they can wash it and all of this. But if you're aiming for natural fertility, then this is the area where we really want to optimize semen health for sure, if we're kind of just scraping into the normal range. And the next step up from semen analysis is DNA fragmentation testing. A lot of your clinics will say, yes, you can do DNA fragmentation testing, and yes, it can predict all of these things, but there's nothing you can do about it anyway, so we don't offer it. Whereas actually there is a lot that you can do about poor DNA fragmentation from a holistic sense. But what is it? So the DNA that's housed within a head of the sperm is passed on. So 50% of the embryo will be made up of DNA from the male partner, and 50% is coming from the female partner. So the DNA inside the head of the sperm is passed on to the egg to form the embryo. So it's really, really important that this DNA is intact, and you can't necessarily tell from all of the other parameters of a semen analysis whether the DNA actually is intact or not. The rates of DNA fragmentation can predict miscarriage rates. So certainly if a couple are experiencing repeated miscarriages, I would highly recommend having DNA fragmentation testing as part of your testing. The DNA is protected inside the head of the sperm from free radical damage. So what you need to protect yourself from free radical damage is actually antioxidants in the diet. And I'm sure you've heard how important antioxidants are for male fertility. And zinc is one of our main antioxidants that we use for male fertility. In fact, we can't store zinc for very long in the body, so we do have to keep getting it from the food or from the diet. It also acts as a hormone balancer and can it help increase testosterone levels if you're found to be low. It also acts as an antibacterial agent in the male urinary tract, so it can actually help sort of fight infections. As we've talked about before, infections can actually in itself affect male fertility. Low levels of zinc are associated with sperm abnormalities. I use a lab called Examine Labs. The test is called the Sperm Comet. They keep swapping and changing how you order this test now. They used to be able to phone up yourself and just order it. And now I think you need a referral. Before the Sperm Comet was available, it used to be extremely expensive because you'd have to go to a clinic and they would charge crazy amounts for this test. They would charge sort of £500, £600, £700. The Sperm Comet is about £250, which is really reasonable, I think. And I don't charge anything extra, but the IVF clinics tend to all use the same lab actually, but they will put a premium on top, but it's the same test. And if you happen to be dialing in from the US, I use a lab called SCSA Diagnostics over there. So that's DNA fragmentation. And one of the main things actually that affects male fertility is obesity. So, and that's classified as a BMI above 30. You know, BMI is not the perfect way to measure, but, you know, for the purposes of today, let's accept that as, you know, a good measure of your body mass, I suppose. And you can just type in BMI calculator into Google, and it will pop up, and you can do that quite quickly yourself. We know that obesity is associated with high levels of DNA fragmentation and abnormal shapes, lower sperm counts, and concentrations. It's associated with a reduced rate of live births per cycle of assisted reproductive technologies, and a 10% increased risk of miscarriage. And part of the reason why obesity is so problematic is because it creates heat. So heat, because of the higher body mass around the testicles, just simply damages sperm. And it's also our adipose tissue, which is where the fat is stored, fatty tissue is stored, is a metabolic organ in itself, and actually affects hormonal balance and can produce some hormones, especially some of the hormones that actually counteract testosterone. So it's worth kind of looking at weight loss. And actually it seems as though you don't need to lose an enormous amount of weight to restore your fertility. And I would always advocate sort of slow and steady weight loss because of overall impact of health of sort of crash dieting. I said we would talk a little bit about toxins. So these are just some slides that I stole from a presentation that I do to my clinicians. And just a quick snapshot at some of the toxins that you might come into contact with. And it's so important now to be aware of this. So BPA are found in plastics, especially soft plastics, so things that can sort of be squished, like plastic bottles are a good example of something that will usually contain BPA. The very first human study on BPA and male fertility was done in 2010, so not that long ago if we're looking at kind of overall time that people have been researching fertility. So the researchers are just kind of getting their eyes open to this now. The men had the BPA measured in the urine, and those with the higher BPA concentrations had lower quality sperm. Lower sperm concentration, sperm count, decreased sperm vitality and motility. And actually they found that men with levels of exposure equal to those that most of the general US population is exposed to had signs of sperm stress. So, and please don't be fooled by BPA-free products, because we are now finding that they use BPS instead, or other additives to the plastics. And actually now the studies are coming out to show that those are potentially even worse. So I don't know if you can see me on camera, but just get yourself a steel canister for your water, or a glass bottle, and swap your lunch boxes. There's lots of non-toxic steel, food grade steel products on the market that are not particularly expensive and so worth using. And also one of our main exposures nowadays of BPA is actually till receipts. So till receipts are printed on BPA impregnated paper, and I found a study that showed that when you have used antibacterial gel on your hands, you absorb more BPA than if you didn't sanitize your hands. So we just have to be super aware of kind of where we're exposed to these things, and ideally just don't take the receipt if you can avoid it unless you need it. Phthalates and semen health. So these are plasticizers which again are used in vinyl flooring, cables, medical devices. So if you and also perfumes, lotions, cosmetics. So if you're somebody who are doing lots of DIY, or maybe you're working in the building trade or something, that you just do need to be aware of your exposure here. They are also associated with problems when it comes to semen health and male hormones as well. PCBS, again, PCB exposure, again, consistent effects on most areas of semen health. So, and just one final word on pesticides. So again, they've done studies on pesticide sprays in Japan, and they've got double the rates of non-progressive or slow progressive sperm, so basically sperm that couldn't swim properly. And the effects were not seen in winter when they weren't spraying. And in Peru, pesticides were associated with decreased semen volume and increased semen pH. I'm sure you've heard of the farmer last year who sued Monsanto because he ended up with cancer after spraying fields with glyphosate, which is sold in the UK in the DIY stores, and you're free to use it in your gardens. I've seen my neighbour use it on his front drive, and it just really stresses me out. It's so bad for health. And if you don't buy organic produce, then you will be exposed to glyphosate, and the levels in things like lentils and other products like that and oats can be very, very high actually. So I would highly recommend you actually choosing organic products if you can. Aldi now have a great range, which is really quite low price. So I don't know if I can see. I don't know if it's the chat box, but Abby, please interrupt me if you have questions. Here's just another study that showed that pesticides were just terrible for semen health, and they also had higher frequency of chromosomal disorders in their sperm. So what should you eat then? So this, you might just want to take a quick screen grab. I'll just talk through the slide. So the Mediterranean diet comes consistently out the highest for both male and female fertility. The Mediterranean diet is not pasta and pizza. It's enormous amount of vegetables. And I'm half Italian, and in Italy, they eat them local and seasonal, which does mean that they've come, they've picked when they're ripe, and they've not traveled too far to get to you, and therefore most likely the nutrient levels are higher in those vegetables and fruits. They eat whole grains as opposed to the refined white sugars and grains. They have fish and seafood twice a week, minimum. They eat nuts and seeds. They don't eat terribly large amounts of meat. They sprinkle olive oil liberally on their food. I would say go for about 4 tablespoons a day. That's a good amount for not just for fertility, but also for all other areas of health. And they don't eat large amounts of dairy or poultry either. But the emphasis should be on really fresh food, and avoiding processed foods, fried food, and snacks. The reason for this is because they're low in nutrients and they're high in pro-oxidants, so they will be sort of mopping up the antioxidants which you could have used elsewhere. They also tend to contain potentially harmful fats, which again really doesn't help your cellular health. Higher intakes of processed red meat is associated with poorer sperm morphology. Sausages, ham, corned beef, beef jerky, bacon, and salami is something that you probably shouldn't be having every single day. Those are for kind of the odd occasion, really. You can get some really good quality sausages nowadays, and I would just go to somewhere like Riverford or someone that sells the higher quality with more meat. So they would be, I think they have to have a certain amount of meat to be called gourmet sausages. So I think, is it 97%? Because otherwise up to 40% of a sausage can be just stuffing or just bits cheap stuff that they add to the sausage to make it cheaper. So it's worth just having maybe slightly less and buying better quality. Organic food is associated with better outcomes of IVF. I would extrapolate that and assume that that's also associated with better outcomes for natural fertility. There are no studies. Organic food has a sort of double whammy of being lower in pesticides and higher in nutrients, and also tasting better. Usually they are, if you get them from like the likes of Riverford, then they're more or less locally produced and very much in season. Organic fruit and vegetables are associated with higher sperm counts. If you struggle to find organic food where you are, or if you're struggling financially, I know that loads of people are right now, I would recommend that you look up, just Google the Dirty Dozen and the Clean 15. So every year this list is produced by the Environmental Working Group that lists the most sprayed versus the least sprayed fruits and vegetables. So you know which ones you really should be avoiding. And usually they are apples, pears, strawberries, spinach, peaches, kale high on the list. I can't remember, but it's definitely worth just focusing on those if you can. People always ask me about gluten. There is no research on gluten, but I think sometimes doing a gluten elimination can help if you've got inflammatory problems, or if you've got other health issues, especially if you've got gut problems. And a lot of the time when we cut something out like bread and pasta, it allows us to make more room for foods that are actually much more nutrient dense, like the other grains, for example, buckwheat, quinoa, maybe, just sort of branching out a bit, and sweet potatoes and other root vegetables that I think, may be better to fill up on because they're higher in nutrients, or even beans and pulses. So where can you find the antioxidants then? So this is something that you'd really, really, really want to focus on if you are looking to improve male fertility. There's an enormous amount of studies that shows antioxidants are super helpful, and please don't rely on a pill. I'd rather you weren't rattling around, but actually just learn to eat really healthily for life, not just for the 100 days it takes to mature a batch of sperm, because it's really going to filter through into kind of longevity and wellness later in life, and also as you start your family. I think it's nice to start off all eating quite well, because then you'll grow a healthy family as well. But rather than kind of buying a pill and thinking, oh, I've done my bit. So antioxidants are found in fruits and vegetables, and what you really want to do is look for the deeply colored ones. So squash, sweet potato, spinach, kale, beetroots, all of the ones that have got that deep color in their flesh. Blueberries as well, if you can get hold of the wild ones. If you're lucky enough to be able to get hold of them, then they are great. They protect our cells from free radical damage, so they're actually protecting that DNA inside the sperm from being damaged from free radicals, which we can't avoid. Free radicals, they're all over, they're all around us, in the air we breathe, and even our body actually produces free radicals as part of normal processes. And especially if you're somebody that exercises a lot, exercise releases free radicals. So you just have to be aware that it is important to get your antioxidants in. And you might be sort of lighting your wood burner at this time of year, and that's actually quite a high source of pollutants. And I would say this year, particularly because of respiratory health, we want to focus on that. I would say, don't turn that, don't light that fire every single day. It's probably best not to. So antioxidants improve all parameters of semen, and you want to basically eat every color: green, red, blue, orange, yellow, white, have I missed one? You want to cover those every single day. So eating a rainbow every single day is the best way to know that you have covered yourself. And especially it seems that lycopene, which is found in tomatoes and watermelons, is particularly good for men and for male prostate health as well. Lycopene is concentrated when it's cooked, when the tomatoes are cooked. So if you're making a stew or even a tomato soup or something like that, get a jar of passata and put it in the slow cooker, or make a tomato soup and maybe put a couple of other bits of vegetables in there, and that would be a nice little antioxidant boost, which you can batch cook and reheat. So healthy fats are also really, really important because every single cell in our body is made up of a lipid membrane, and those lipids come from the food that we eat, and we don't want that membrane to incorporate trans fats or fats from shelf-stable foods, because they have been altered generally to make sure that they don't go off or go around, sit on the shelf when they sit there for a long time. But what happens is that our cells start to perform poorly, because our cell membrane actually is how we communicate with the world outside the cell. So we have hormone receptors on the cell membranes, and all of the nutrients and chemical messengers are sort of coming in and out, and you want your cell membrane to really function really well. And one big piece of that puzzle is to actually eat really healthy fats. So you don't want to be over sort of frying your food or cooking your food at super high heats all of the time. So steaming is better, or kind of flash frying as opposed to frying something for a long time. And what you do want to focus on is increasing your omega-3 fatty acids from foods such as oily fish, walnuts, flax seeds or flaxseed oil. Those are the main kind of sources of omega-3 fats. And also, if you're buying organic meat, which I know is expensive, but we don't need to eat an enormous amount of meat. Certainly the Mediterranean diet doesn't really include that much. You can really sort of buy a chicken breast and split it into two and share that, and that's actually plenty as a portion. But if you buy grass-fed or organic, kind of free-range chickens or beef, then their fat composition will be different to those that have been fed on grains as well, or soya fed. Nuts are things that I get all my male clients to eat if they are not allergic. Men who eat nuts daily have been shown to have improved fertility. They are really high in zinc and selenium and other antioxidants and minerals that we need for fertility. And so I would say go for 1 or 2 handfuls a day. Obviously don't kind of think that you should be eating a whole bag of nuts every single day, because they are quite high in fat as well, and you can you don't want to be putting increasing your weight and inadvertently. But say an apple with that 8 to 10 almonds, for example, that would make it quite a nice snack if you feel that you need a snack in the day, rather than a biscuit or a slice of cake or whatever else that might be available in the shops. It's so easy, you can carry it with you. You don't need anything in particular to prepare it. Vitamin D as well, I test every single one of my clients without fail. You can get a test via Better You. Because of COVID, they have been sold out. Every time I've checked, they've been sold out this year. You can also buy vitamin D testing from Medichecks. And you can buy it from, actually the place I get it from is called vitamindtest.org. And you can bulk buy them, and I just buy them in packs of 10, and I send them to my clients, I give them to my family. I think especially in this day and age, vitamin D is so important to make sure that you have enough, and it's really, really hard to get enough from food. Yes, you can get it from sunlight on your skin, but not at this time of year. And actually, I just had my daughter checked who, I don't cover her in sunscreen. I do let her go out in the sun, and she's already low. And she had the test, I think, 3 weeks ago. So yeah, it's so common to be deficient, but what you do want to do is actually test so that you know how much you need to take. And I test myself and my whole family twice a year. It's just a skin prick that you do at home. It's very cheap. I think it's about £30. And it's so important for male and female fertility that you've got enough vitamin D. And we're aiming for, you might want to write this down because the tests will tell you something different, but for fertility, you're aiming for between about 100 and 120 nanomoles per litre. Everybody always asks me about alcohol. We have studies that show that it's not terribly harmful. And we have studies that show that there are effects on all semen parameters. We certainly have no studies that show that alcohol is beneficial to fertility. So it's generally either harmful or no, or makes no difference. So I tend to ask you to absolutely minimize alcohol. I think a lot of people in the lockdown period have sort of been drinking a little bit more at home, but it is worth really kind of knocking that on the head because, again, alcohol will mop up your sort of antioxidant reserves. It puts pressure on your liver that's there to actually process the toxins that you come into contact with. And so it's just sort of making extra work for your body, I suppose. And again, I believe that the reason why studies are so varied is because we all have different lifestyles, we have different genetic makeups, and we have different dietary factors, which all play into how well you do at detoxifying. So there are lots of lifestyle ways that you can use to actually improve your detox capacity, which we're not going to go into today. But so for those people, they may be able to potentially actually cope with a little bit more alcohol. But I would say, one glass of wine on a weekend is probably not going to be here nor there for most people. But one glass of a day or half a bottle a day, that's probably not going to be particularly helpful. Caffeine again, so we have conflicting evidence. It seems to be that it's a little bit more problematic for women actually, but we certainly, it seems to take longer to get pregnant with the male partner consuming caffeine. So if you're somebody that drinks, I used to work with somebody who drank 14 cups of coffee every day, and I counted it once, which is how I know. And that's just not okay actually. I think that's too much for many reasons. But if you're somebody who's a high coffee drinker, then you might want to consider cutting down or going for a decaffeinated couple of cups. I would recommend the Swiss water decaffeination process. I think most supermarkets sell Grumpy Mule, which is a brand that's got a non-toxic decaffeination process in their decaffeinated products. We certainly know that soft drinks have a clear detrimental effect on fertility. So soft drinks containing caffeine. So please do stop having those if you are, even if they are sugar-free. They're not good. Yeah, okay, so that's that about coffee. Exercise again, we know that those who don't exercise enough and those who exercise a lot both have impaired fertility, but moderate intensity exercise is the kind of optimal for the healthiest sperm possible. Resistance training is especially beneficial. It is really important to move and sweat because sweating takes the pressure off the liver and other detoxifying organs because you can detoxify through your sweat. But you don't want to be doing too intense exercise. Now, I have worked with an enormous amount of men who commute to work on their bike through central London, and just just be aware that being on the road on a bike is gonna squish your testicles, which is going to cause heat to be generated in the area, and you're also going to be putting yourself in front of an enormous amount of pollutants, which will be mopping up your antioxidants like nobody's business. So taking the scenic route, taking a couple of days, of actually just commuting on a train. I mean, I think maybe a lot of people are working from home now, so that's not so much of a problem. But even if you're a weekend cyclist, just really be aware that you might have to give that a bit of a break for a period of time. You can get special saddles, which are supposed to be better. The name escapes me now, so I know that I'm very near the end of my slides. Good quality sleep. So men, I think men are sort of, they ignore sleep a lot of the time in my experience, and they sort of go, sleep is for wimps, or, sleep, it's just not productive to sleep. But actually, your fertility, your testosterone levels, and your immunity hugely benefit from getting a decent number of hours sleep. And my advice would be, don't go to bed after midnight, and sleep between 7 or 8 or 9 hours, depending on what you need personally, but a minimum of 7, ideally. Stress, yes, it does impact male fertility because it impacts hormones. I'm not going to go into all the ways that you can sort of find to cope with the stress, but the research shows that actually the most important part is not that you are removing stress, and that's probably quite unrealistic for most people, but finding ways to cope with stress is the key factor in improving your chances of having better hormonal balance. Men need support too. Men are quite often supporting the female partner who's better at talking, but try to find somebody that you can also talk to. And there is a men's fertility support group on Facebook. I think that's what it's called, Men's Fertility Support. And there's loads now on Instagram as well, and on the Fertility Circle app, I'm sure. So highly recommended. Just quick word on cigarettes and anything related. Don't smoke. Please don't smoke marijuana and or CBD products, and vaping is also not recommended. Whoops, sorry, I've just clicked out of that. Last slide, lifestyle. I'm just going to let you.
Just so you know, Sandra, I think we've got a half screen of your emails on the one side.
Oh.
I think maybe you there you go. There you go.
Where, can you see my slides?
You again now, but your slides have disappeared.
Okay. Oh, can you see them now?
No, you might need to reshare your screen.
I'll just read them super quickly. Avoid toxins. Boxers are better than tight underwear. Mobile phones are associated with infertility, so keep them away from pockets. Wireless laptops, phones, keep them away from the body when you can. You'd use corded headphones, not the AirPods or the Bluetooth type ones, and get away from endocrine disrupting chemicals. So kind of cleaning products and personal care products, ideally use less toxic ones or natural options. Don't use plastic containers for your food or drink, and consider your cookware as well. Are you using Teflon pans and plastics in your kitchen, and eating organic? So that was just the last bit I wanted to say. Sorry that took so long.
No, that's amazing. There's so much helpful information there, Sandra. Thank you so much for sharing so much. I learned loads there, and I'm sure people had some, got some really, really helpful tips from that. So thank you so much. We've had a couple of questions pop through on the chat. Mm-hmm. So I'll ask you those if that's okay. Yeah. The first one's probably a quick one, so we'll start with that. It's what's better, a glass or metal bottle or a BPA-free plastic bottle with a filter?
Glass or metal.
And if I'm guessing the filter point, is that around not drinking tap water potentially? So do you recommend not having tap water, but having it in a glass or metal bottle, presumably?
I personally use a filter called the Berkey. It's very bulky. It sits on a worktop. It's really annoying. You have to fill it every day, but it's the best filter. I would say people in England, if you're living in an old house, you most likely got lead pipe work. And if that is also welded to copper, that's potentially even releasing more chemicals into your water that you're eating and drinking, also cooking with and drinking. So I would, ideally get a decent filter.
Okay, yeah. Saying he's got a Brita bottle with a filter built in.
Yeah, I mean, the Brita doesn't really, it doesn't remove that many toxin or that many chemicals. It's sort of possibly better than nothing. But actually, I used to have a Brita, and I worked out that the Berkey, even though it's a high upfront cost, over its lifetime, it's cheaper than the Brita once you keep having to buy the filter. And also the filters just felt so, for me, just not environmentally friendly, because it's this huge plastic thing that can't be recycled. Or back then anyway, I don't know if it's changed, but yeah, I love the Berkey. And you can get portable ones as well, little ones, but I've got a big one. Oh, you're frozen. Have I frozen? Am I still here?
Sorry, Sandra, I don't know if I can you hear me again?
Yeah.
Okay, wonderful. I'm not sure if that was my my internet being slightly dodgy, but I turned my video off. So hopefully you can hear me again, but thank you for that. There's one other question coming through here. So it's around sperm motility.
Mm-hmm.
So this lady is saying her husband is 32, fit and healthy. He follows a gluten-free diet and he was diagnosed with low sperm motility, but they got through their first round of IVF, which unfortunately ended in a negative pregnancy test.
Mm-hmm.
In the sperm sample since, they've come back with no sperm motility, and he's also had an infection, which resulted in similar results. What's the best diet to increase motility and prevent infection?
If you had an infection, it should be cleared up with antibiotics, and that should fix the problem. Unless there are other things playing into it. So in terms of infection prevention, it's about avoiding getting infected in the first place, I suppose. So depending on what that infection was, it can be any number of things. I mean, there are supplements that we can use that might help kind of break the biofilm barriers and things like that to help the antibiotics work better, but you'd have to see a fertility nutritionist to work on that. Otherwise, in terms of improving your immunity, you want to be making sure that you've got you've got your zinc coming in, your vitamin C coming in, your vitamin D is optimal, your antioxidant status, all of the things really that we've talked about. Sleep is so important for immunity. Sugar, unfortunately, can suppress your immunity. And I read a study that said that eating sugar suppresses your immune function for 6 hours. So those are it's basically the same lifestyle things, really.
Great, thank you. And in terms of sperm motility, is there anything different from kind of what you've said already, or anything specific that really works around the motility?
I think that you want to do all of the things that we've talked about, because if you're sort of just focusing on one, then you're missing so much of a bigger part of the picture. And I can see Julia's on this call. Julia's one of my colleagues, but we are so much more targeted. But my intake form is 10 pages, and we look at trends and things that it's kind of like detective work. So we look at what areas may be struggling, and we support those areas. So we sort of put two and two together, I suppose. And it's just, yeah, I would actually say see a fertility nutritionist, and then you will get very targeted support. And we do have nutraceuticals, herb supplements that we can use as well. But I can't. It's simply not safe to recommend things like that on an open forum, unfortunately, and for insurance purposes as well. I'm not allowed. Sorry.
Yes, totally understand. It's really important, isn't it, to get that specific tailored advice for the individual. But yeah, I think there's some really helpful points generally. So I think following those sorts of things is going to help, obviously with sperm health regardless. But I would highly encourage, people to seek out the support of fertility nutritionist, because it can really, really make a difference in having, firstly, I think keeping you accountable, and also, getting that really, really tailored advice. It makes a big difference. Brilliant. Thank you. So I can't see any more questions coming through, and we're actually, time-wise doing very, very well. We've got a couple of minutes left. So if anyone else has any questions, do pop them in the chat thread. I have just shared in the chat thread a link to a course that Sandra has shared with us. So she has very kindly offered up a 50% discount on her fertility makeover course. And this is a 3-month program that covers tried and
4 or 5 weeks.
Oh, sorry. Apologies. 4 or 5 week program that covers tried and tested strategies to improve your fertility. So it would normally be priced at £350, and Sandra is offering everybody here tonight a 50% discount. So that would work out at £175. So it's super good value for anyone that's interested in that. I have popped in the chat thread, as you can see, the code and the link to Sandra's course as well. So do go and check that out if it's something that you're considering. One other question that's just come through, Sandra, if you don't mind answering it quickly. Is organic pomegranate juice a good idea?
So pomegranate juice is high in antioxidants. It's very, very deeply coloured. So it's one of those things that we would be looking for as part of a fertility diet. It's really expensive to buy if you buy the sort of proper stuff that's almost gloopy and concentrated, but why not eat a pomegranate and get all the fibers and everything that's that it comes with. I'm a huge advocate of eating food as it's found, as opposed to drinking the juice of a food. And pomegranate seeds, I mean, it is a bit of a pain to to get those seeds out, but it's so nice added to porridge, or even to to just brighten up any sort of savory dish. Well, not any, but it's just a nice thing to add, I suppose. But I certainly wouldn't be kind of going out there and buying pomegranate juice to be had every single day. It's better to just look at your plate and making sure that you've got plenty of colour on there every single day.
Brilliant, thank you. Yes, I love pomegranate. I pretty much do sprinkle them on everything. So yeah, they're delicious. Okay, amazing. I think if there's no other questions, then we can look to finish things up. So thank you so much, Sandra, for joining us this evening. It's been really, really helpful. And I'm sure everybody really appreciates all of the insights you've brought. So thank you. We will be loading this playback onto the app probably in the next couple of days. So if there's anything you missed and you want to revisit, just head on over to the app and you will be able to find it there. But thank you so much to everybody. And thank you so much to Sandra. Really, really great to have you. And if there's nothing else, I'll say good night. And thank you to everybody.
Thank you.
Thank you. Thanks. You too. Thanks, everybody.